Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One common question I get from patients is, where do I apply the stim pads for a TENS unit for either my lower back or for my neck? TENS units and electric stim modalities at home, you can apply them to your lower back and neck if you're dealing with pain or discomfort, and it'll help to decrease your pain and muscle spasm in the area. So it's really important you place the pads in the correct location in order to get the most effectiveness. So what I'm going to do is I'm going to show you where you'd apply them for your lower back, and then I'll also show you where you apply them for your neck and upper back. The first stim pads we're going to apply is for her lower back. So depending on your TENS unit, you may either have 2 or 4 pads. So depending on how many pads you have, that may affect how you're going to place the stim unit. So what we're going to do, we'll start off with if your TENS unit has just 2 pads. So what you want to do is you want to find the spine, and we don't want to put the pads right on a bony section there. What we want to do is we want to come out about 1 inch or 2 from the spine, and we're going to place the first pad right there. So we don't want to be on the pelvic bone. We also don't want to be on the ribs. We want to be in that section in the lower back right on the side where there's just muscle. So then what we're going to do for the second pad is we're going to place it on the opposite side. And again, the spine is right in the middle here, and that's how you would place it if you had 2 pads. If you have 4 pads, what we're going to do is we're going to place them in an X pattern on the low back. So for example, channel 1, we're going to do them in an X pattern here. So we're going to place channel 1 up high and then 1 down low. And then channel 2 is we're going to do 1 down low and 1 up high. And so again, if we're looking at it, it's like an X for her low back there. And what that does is this area in between the 4 pads is what's going to receive the most amount of stim. And that's what's going to give you the most amount of pain relief right in that area. Again, we don't want to be too low, so we're on her pelvis. We don't want to be into the rib area. We want to be in that muscular area right in the low back. And that's going to help affect the spine the most in that region if you have 4 pads. To place the stim pads in the neck and upper back region, what we're going to do is we're going to find her shoulder blades. So we're going to just kind of feel around for the shoulder blade region there. And what we want to do is we want to place the first set of pads right in this area, right between her shoulder blades and her spine. So what we're going to do is we're going to place 1 pad right here, and the other pad is going to go on the other side, right between the shoulder blade and the spine. And again, we don't want to be right on the spine, and we don't want to be on the shoulder blade. Ideally, for neck pain, what we want to do is we want to apply them on opposite sides. And this area works the best if you have 2 pads, because this will affect the muscles in the upper back, which will also affect the neck the most. So that's if you have 2 pads. You want to place 1 on one side in between the spine and shoulder blade, and then the other one is going to go on the opposite side. If your TENS unit has 4 pads, to apply the pads, what we're going to do is, just like the low back, we're going to apply them in an X pattern in the neck and upper back region. We're going to put 1 up, down, lower in between the shoulder blades, and the second pad for number 1 is going to go up high on the neck. So what we're going to do is we're going to take the number 1 pad and we're going to place it right in the muscles right on the side of the neck. And then for the channel 2 pads, what we're going to do is we're going to apply 1 down low, right between the spine and the shoulder blade. And then to create that X pattern, channel 2, the second pad is going to go up high. And again, we want to be right in the muscular area. We don't want to be right on the spine or into the skull. We want to be right in this muscular region right there. And again, that creates that X pattern between the 2 different channels. And then the area that's going to be most affected by the stim is the area in between those pads. And again, so just remember, if you have 4 pads, you want to apply them in opposite directions here. So 1 down lower and 1 up high. And then the other channel is going to be the opposite side, 1 high and then 1 low. So I hope that answers a common question of where should I apply the stim pads for my TENS unit if I'm dealing with lower back or neck pain.